Deepa,
Yes, yes, ma'am.
show the PPT one. It is not, sharing is not getting completed.
Ma'am, your sharing is there. We can see your slides.
You are seeing the slides?
Yeah. The first one is efficient memory.
Okay,
Yes.
you are able to see, then I can start presenting, no?
Yeah. Just do the view mode. Yeah.
Yes, now you are seeing it. Agree?
Yes, ma'am. We can see it very much clear.
Okay.
Anyone has any problem, do let us know. The screen is being presented by ma'am. And as instructed yesterday, again, tomorrow the instructions go same that please keep a pencil as well as a notebook with you handy. If you have any problem, any confusion, you can ask immediately with ma'am.
Yes, good evening, everyone. Happy to be with you all. I don't know about you. Are you happy or not coming to this session? Okay, let us see. Yesterday there were some hitches are there for starting it, and today I could overcome. For my age, this technology is difficult for me to handle, and I'm trying to do it because of my passion for students and for teaching. That made me to do it. And yesterday we learned what are the method, how to make it an accurate, comprehensive, impressive answer when you are answering in the examination. And before that, lot of preparation is required for us for facing the examination, and that is how to remember the things. You know, no doubt all of you will be reading good, and how to remember what you have read and how to make it get consolidated in your brain, and it should appear without any hesitation during the examination. Let us try the various methods. All of you must have adopted some method, and there is a meaningful method is required rather than rote learning is there. So where we have learned 2 2s of 4 like that, that is a repetition part, and better long-term memory has to be retained. And how you can retain it? And first thing in the anatomy, dissection is the best one. Cadaver is the best teacher, as we always say. And then if you follow the cadaver, you will learn the topic. And because in situ you are seeing it, and you know what is right, what is left, what is above, what is below, and what is medial, what is lateral, what is superficial, what is deep. And you can add some mnemonics and some memory aids, visual or auditory, whatever is convenient for each one of us, and some analogies and how to repeat, spaced repetition and active recall by using the flashcards. Now, so many visual tools are available, 3D anatomy, visual anatomy, so many are there. And you should have a smart personalized study strategy and get the feeds from all sources and adopt the one which is suitable for you. See this one. So this has stimulated me. And are you seeing some numbers you are seeing? So from which number to which number you are seeing, you should be able to see. And for me, I have seen 1 to 12 numbers. What are those 1 to 12s? Which you know in anatomy are the cranial nerves. So in a numerical order it is there, like our attendance numbers. So I tried to draw them, and all these numbers, they are fitting into the face. Very good. Cranial nerves we are talking. Okay. So when we ask you to name the cranial nerves in order, you just fumble. And when we ask you to show them in the cranial cavity, again you go on feeling difficulty. And let us see how we can remember these things. So if you see, the first cranial nerve is olfactory. So that is the one. And this is the cribriform plate of ethmoid. That is the first cranial nerve that comes into the cranial cavity. Then the second is the optic in the next foramen. So from the anterior to posterior, if you go on observing the foramina, you get the sequence of it. So the second is the optic nerve. You can see it going through the optic canal, coming out through the optic canal. And then if you see, the 3, 4, first division of 5th and 6th cranial nerves, they pass through superior orbital fissure. So between the lesser wing and greater wing of sphenoid, you can see it. And the 5th cranial nerve has got 3 divisions, trigeminal. That's why it is called. First is the ophthalmic, second is the maxillary, then is the mandibular, and the ophthalmic goes through the superior orbital fissure, and immediately behind that, the foramen is the foramen rotundum. Through that, the maxillary division goes, and through the third one, mandibular division, next to foramen is the foramen ovale. Through that, it will go. The ophthalmic division goes into the orbital cavity. The maxillary division goes into the pterygopalatine fossa. The mandibular division goes into the infratemporal fossa. That's how the fossas in relation with this area you will be seeing, and you have to link these nerves to them. Then this is foramen spinosum. Let us not talk about it now because we are going about along the cranial nerves. That is our main idea. Then you may see another foramen. Foramen lacerum is there. Through that nothing will pass. Then there is if you see here, there is the internal acoustic meatus, which you can see in this side. This is the one, 7th and 8th cranial nerves are going through it. Then the 3 nerves, 9, 10 and 11, they go through the jugular foramen, which you are seeing in this one. Then the last one is the 12th, the anterior condylar or hypoglossal canal. Through this it will go. So if you remember in order from anterior to posterior, looking at the foramina, you will never get tensed up in identification of this. And whatever mnemonics we may think of is the next one. See, so the difference between rote learning versus creative learning. So if we focus on the cranial nerves exit foramina, how many are to touch and feel very green vegetables are? So that may be a mnemonic for it. But rather than that, I feel if you practice on the skull and make a table like what I have shown in this one, you will remember it forever and make it a flashcard and keep it handy so that you can read them again and again. Then see this picture, animated one, which I could do whatever simple one. What you are seeing is the cut section of the sagittal section of testis, and what is that? Look like you are sharing videos or animation. These are animations. Okay, so share computer. There are no audio for this, only movement only. I need not do it. So you can see the spermatozoa, where they are produced in the seminiferous tubules and how they move out through the ductus epididymis and how they will be deposited. And another one also, you can see this is the cut section which you draw for what you have understood from this animation which I have focused. Then if you see here, this is the other one in the male reproductive system. How you can see the parts of it, you can see the prostate, seminal vesicle, and the vas deferens is also there. And then there is the how it comes out through the penis. You are seeing the deposition of spermatozoa. And by looking at these videos, so just by looking at the videos, don't keep quiet. So you have to draw what you have understood and how that structure, which I have mentioned as the spermatozoa moving about. Then you can have a flow chart like this and how it comes out through the seminiferous tubules, coiled part, straight part, treaty testis, the components of testis, then efferent ducture of testis, duct of epididymis, vas deferens, ejaculated ducts, and how it comes out through the urethra. You have learned it. So don't think that by just watching a YouTuber, you will learn it, and by the side you have to draw or write what you have understood, and then see the other one. But the commonly asked question, spermiogenesis is asked. And what is spermiogenesis? That also, what are the changes that will take place for the nucleus, for the conversion of the rounded spermatid to spermatozoon? For that also, you should know what are the things that are happening and what happens to Golgi apparatus, what happens to the nucleus, what happens to proximal centriole, the mitochondria, the distal centriole. So like that, if you, by looking at an animation also, you can practice the one. And next is, so when we talked about the spermatozoon, we should also talk about the how the ovum is released, and this is how you will be drawing the diagrams. And what is the basis for drawing the diagrams? If you look at this one, you can see the movement of the ovum and how it will be circulated in the female reproductive tract. I would like to play again and go back and play. Something happened, it is not playing. Should play, it was playing, and I will see at the end whether I can do something for it, for getting it played. This was playing and this was not playing. And now you can see how the follicles. So what are the different types of follicles? I have put a picture here, primordial follicle, primary follicle, and how it becomes secondary, mature Graafian follicle, and what is ovulation you can see, and what is corpus luteum. Hope you are able to appreciate. Then the next stage is fertilization and implantation we study. See that after the release of ovum, where fertilization takes place, and then what is zygote, what are the various cleavage divisions, what is morula, what is blastocyst, and how the implantation will take place because of the changes in the trophoblast, syncytial, and then the cytotrophoblast. So previously I used to draw like this and then show these things, a little bit of animation. If we are familiar, we can draw it. And when you are seeing it, you have to note down what are all the events that are taking place during the first week of development, so that you will understand if a question is asked, and try to make the points like what you are seeing and what is happening during that time. And if you want, you can watch it again because it is playing. I wanted you to get more benefit from what I am showing. Hope somebody can say whether it is okay. And if there is any problem, you can put the messages, and Dr. Sinha, Deepa Sinha will be looking at it.
Yes, ma'am. Yes, ma'am.
Yes, okay. And then the other one, now all of you be prepared with your pens and pencils because you have to note down a lot of it. Because if you want to be thorough with the extraocular muscles of eyeball, because if you go to ophthalmology, that is what you will be seeing cases where they will be repeatedly asking you questions on this one. And then what are the things you are supposed to learn? You can use different methods for learning it. And what we need is the extraocular muscles of eyeball, which I say we divide them into recti 4, obliques 2, and levator palpebrae superioris. Then the next component which you should be able to remember and is the origin of the muscles, and where from they will take origin. Recti from the superior orbital fissure. That's why the importance of it. The common tendinous ring of Jin, how it is attached to superior orbital fissure, and about the body of sphenoid and the maxilla, and from the lesser wing of sphenoid for the levator palpebrae superioris. For convenience, I have written abbreviations, but in the exam, please try to expand them. Then what will be the insertion? If you know the anterior pole and posterior pole of the eyeball, imagining it as a globe, then what will be the insertion of the recti is in front of equator, obliques will be behind the equator. These are the things we will be asking repeatedly, and you may get MCQs also. And what about the insertion of levator palpebrae superioris in relation with the eyelid, upper eyelid, tarsus, and conjunctiva? Then what is the mnemonic for remembering their nerve supply? So superior oblique by 4th, that is the trochlear nerve, and lateral rectus by 6th, that is abducent nerve, and all the others, that is around 5 muscles are supplied by the 3rd cranial nerve by means of superior division and inferior division. Then what is the action? So you are seeing different pictures here. So the movement takes place in the 3 axes. Imagine the globe and frontal to posterior pole, anterior to posterior pole, 1 axis, and then from above downwards, 1 axis, laterally the other axis. So we call it as the transverse axis, and sorry, I will go back. And the three axes, the anteroposterior axis, you can see 12 o'clock, 9 o'clock I have put. There will be intorsion or extorsion will be there, and vertical axis. So I have put the nose in the middle. So from there, adduction and abduction, and in the transverse axis, elevation and depression, the arrows. This will make you understand and what will be the applied anatomy of it. So applied anatomy is because we know the cranial nerves. So the applied anatomy of cranial nerves. So when we are want to learn methodically, we should have a checklist. And with this background, these are the components which we have to complete. Then what are the movements of eyeball? You should know what is the basis for describing these movements. What are the axes along which these will take place? What are the muscles and what is their origin, insertion, axis along which the movement takes place? And the nerve supply of these muscles, effects of injury to the nerve supplying these muscles, how the movements will be affected. Then see, so many pictures I have kept, all drawn by me, and except this this is a photo in which we have marked the actions of muscles. And you know, there is what is optical axis and what is visual axis. You have to see it. And orbital axis, orbit how the eyeballs are placed, and what is the position of the nasal cavity, what about the horizontal medial walls and the lateral walls of both orbits meeting at 90 degrees, and the long axis of orbit and visual axis you can see. And these are the axes which I have shown: lateral, transverse, anteroposterior and vertical axes. And you can see in this picture the muscles. So you have to practice this one. So once you go to clinical side, they are definitely going to ask. Now also we ask these things. And what are the turning movements of the eye? It has to move towards the nose horizontally. And I have given what are all the muscles that are there. So how this four recti, what is their action? You can see medial rectus, lateral rectus, because it's the abductor. Okay, that's why abducent nerve. To look down and out, inferior rectus. To look up and in, superior rectus. Up and out, inferior oblique, superior oblique, down and in. So to see the nose itself, one of oneself, that is convergence for focusing on the near object. So that's what you have learned. And then see. So now the another thing is, sometimes you may get a question on superior orbital fissure either for 3 marks or 2 marks, 5 marks, or one of the MCQs. So now you know the origin of the recti, you should know, and what is their insertion and in relation with sclerocorneal junction. What about the obliques and origin and levator palpebrae superioris. If you draw this diagram, you know what is the annulus of Ginn, you can see, and how the recti are taking origin. And see, another thing is, you have to remember putting this lateral, medial, superior, inferior, those directions you have to put. Then only you can see, draw the correct diagram. See the medial rectus, where you have to draw, lateral rectus where, superior where, inferior where. And then the orbital fissure you are drawing, part of it is enclosing this Ginn. And then what will be the position of the nerves? So for that also some mnemonic you can use. Superolateral, LFT means the lacrimal, frontal and trochlear nerves. Then the superior ophthalmic vein, that's what it indicates. Then in this intermediate part, you can see the superior division and inferior division of third, and then the nasociliary nerve. The middle is nasociliary, and lateralmost you can see the sixth nerve. Okay, then in the inferior compartment, inferior ophthalmic vein. So these type of observations and noting down will help you in understanding it. And see, another one is, you should draw one like this, showing the directions of muscles and where to put each muscle also in their correct position. See, superior rectus here, then inferior rectus, superior oblique and inferior oblique. So then you draw this arrows in those direction, and you have to, when I say this is adduction means, so what side it is, you should be able to tell immediately. So it is to the lateral. And this is abduction, means adduction towards the nose and abduction away from the nose, that is towards your ear it is moving. That is the one. And what is depression, what is elevation. And I have put the 12 o'clock position of the cornea also, and the directions for elevation and depression. All these you should see and correlate with the diagram which you have seen, picture which you have seen in that baby. Then based on that, keeping this in view, once you are understood this diagram and whatever memory part which we could focus, and then like a mind mapping, you can do it. Once you are thorough with this, understand this one, you can prepare a table for presentation ready, and depending on the direction of these arrows, you can write the actions also as I have shown in the table. And then I have highlighted these numbers. So what is the distance from the in front of equator, these muscles? So I have put a one, if you start with the medial rectus, then you can go the number from medial to inferior clockwise. If you go 5 millimeters, 6 millimeters, 7 millimeters, and 8 millimeters, like that you can remember. And if you also plan to prepare a table like this and still with more details, you can think of it and do it. Then the nerves also, you should have the thorough knowledge about the nerves. That is the third oculomotor nerve, which is commonly asked the question. Nuclei of oculomotor nerve is commonly asked. That also you should prepare. Then the abducent nerve and then the trochlear nerve. These are the ones you should be thorough. And in one of the exams, one student, how they have presented it is nicely with the abducent nerve and a brief course of what they have understood, they have presented it. And this type of thing also is okay. The handwriting is also okay, and it is a meaningful diagram and with a flow chart of what they have understood, where the nucleus of origin for all cranial nerves you have to write, and then their course. Then how they will be coming out of that cranial component, neural to outside they will come, and how they are going through the what fissures they are going, and what are the other structures, and how it is supplying the muscle. If you see this picture, so it was nicely represented, and action also at the end mentioned that candidate. So this is how you have to be thorough with those nerves part. Then the testing part, I use the last one is so how to test the extraocular muscles for double vision, okay? And position of false image. Double vision means there is a real image and there is a false image will be there based on the false image. False image, if you see in this picture, you have to show in dotted lines in this picture I have shown. Then what is diplopia also you should mention. Paralysis of a nerve, deviation of eye will be there following the paralysis, malalignment of the eye will be there. So retinal image will be wrongly projected, so it will miss the macula, and how it will happen, macula of affected eye, image from unaffected eye remains on macular target. That's why it results in double vision. And for each of it, you can have a table, but the basis for this table is what is drawn here, and this is what you have to practice. The blue one is the real, and the dotted orange is the false image. And if there is a lateral rectus paralysis, what will happen on looking to paralyzed side? So false image is, where is the false image? And similarly, medial rectus, when the person will find diplopia is on looking to normal side. So what will be the position of the false image? And it is medial and parallel to true image. So these two are medial or lateral and parallel to true image. And if you see the recti muscles, see the way, oblique direction of the images you can observe. Then it is. So this is the oblique, and internal to true image will be the superior rectus on looking up, inferior rectus on looking down, and whereas the obliques will be outside, external to true image, but they are oblique in direction. So hope you are able to follow this one, and hope you have noted also, and it is there in the most of the books also. Then after that also, if you are not satisfied, and we gave an exercise to the students, and one student will make the other one learn, and he will test the muscle.
Good evening. Now we are going to test extraocular muscles of the eye. This is my subject. By placing my finger tip of his eye, I am instructing them. See the tip of the finger and follow it. Don't move it. Now, from the center of the eye, now first we are testing the right side of the eye. I am going to test medial rectus muscle, which shows adduction action. And from here I am going to test medial rectus muscle, which shows elevation and torsion. Again, coming back to the position, we are testing inferior rectus muscle, which shows depression and distortion. Again, coming back to normal position. From here, I am going to test ventral rectus muscle, which shows abduction action. From here, we are going to test the inferior oblique muscle, which shows elevation and torsion. Inferior oblique muscle shows depression and distortion. Thank you.
These are the methods you can practice on your friends and learn it. So, in this long essay, long topic of extraocular muscles, I have used the mnemonics, visual tools, color coding, drawings, tables, flowcharts, mind mappings, videos also. Okay. So then when you are studying, so if you see this image of the eyeball, you can see the histological structure also. You can identify the retinal layers. Here you can identify the corneal layers. And when you go to with this orientation, if you see the cornea slide, you can identify what are the layers of cornea, and you can practice a diagram showing all the layers. I don't want to go into the details of those layers. And similarly, you can see the structure of the retina, and you can draw a diagram, representative diagram. It may not be very good, but representative diagram should be there. You will be able to draw. Hope you are able to understand this one. And then now let us go to a little lighter side after a serious discussion of the extraocular muscles of eyeball and dialogues of structures, acronyms we can use. So that what is the use of this one? Because this one will make the concept stick. That's why the movies, some of the movies and movie dialogues, they are imbibed into your brain very much. And those movie dialogues also, some of them you can correlate with what you are studying and correlate with the anatomical basis, why that person has Prabhudeva's dance. If you say, so what are all the movements that are taking place, at what joints they are taking place, like that also you can start thinking it to remember it. So if we used to teach direction of nutrient artery, what is that dialogue of nutrient artery? I'm going to the elbow, and from the knee I will free. That is the one direction of the nutrient artery, and carpal bones. So she looks too pretty. Try to catch her. This is the one which we use for mnemonic for it. And for suprarenal cortex, I have used the GFR. You may be wondering, GFR, sweet, salt, sex, what is that? So what are the layers in the cortex? Starting from superficial to deep, there is the zona glomerulosa, zona fasciculata, and zona reticularis. So reticularis is nearer to the medulla. And what are the hormones they produce? Glucocorticoids, mineralocorticoids, and sex steroids. Now you will understand why I use the word sweet, salt, sex. You can understand. Then there is so in this picture, anyway, you can practice the carpal bones. Then what are the major openings in the diaphragm? That is also IOA, so 8, 10, 12. So what is the opening of the inferior vena cava? What is the level of opening of the esophagus and the aorta? That is 8, T8, T10, T12. You can remember. And this picture is about the nutrient foramen. Then another thing is, so when a question of blood supply and lymphatic drainage of thyroid gland, so you are seeing this handwriting, okay? So it may not be impressive, but it can be understood. Yesterday someone was telling, when my handwriting is not good, how to make it impressive. Use the capital letters, that is one way. And don't go on writing the lines, so many lines, and try to practice to write points. And in that points also you can use capital letters if your handwriting is bad. So when this question is asked, how you have to see is what is the arterial supply, what is the venous drainage, and what is the lymphatic drainage. Because see this question, this is blood supply. Blood supply means you have to write both the arterial supply and venous drainage, so that you remember, and you write down the names of the arteries and where from they are coming, that you use. And similarly the veins also, so where they are draining also, you make a map like this. And lymphatic drainage also, how they will be upper group, lower group, each one lateral, medial. Then all the things you can put in one diagram, like the one which you are seeing. Hope this makes your job easy, and it will save your time. And one student practice it like this. This is also thyroid gland. So veins, she has shown. For veins, I am showing it. Arteries also, that is drawn. So this is how they have mapped and drawn it. These are some of the things which you can think of it and use it. Then the brachial plexus and axillary artery, that is one thing. And though it was taught in the beginning, as if you feel that you have understood it, but at the time of examination, you do so many mistakes in drawing a diagram and in identifying the one. And the relations, because axillary artery is related to it, and you should remember about that axillary artery and what is its course and how it is divided and what is it that is dividing. Like this, you practice one and use the different codes for each of the different chords of plexus, and then this picture will show. So what is the dotted one going behind, and is it completely behind or changing its direction, and what happened to posterior cord, and what is the relation of medial cord and the other chords for the first part, second part, and third part of axillary artery. And this is how you can understand where from the roots are coming, trunks are there, divisions, and what is supraclavicular, retroclavicular, and infraclavicular parts of the brachial plexus. So like this, this should stimulate you to use that. And you are seeing all those things crowded in one slide. So if you prepare a chart like that, flow chart, flip chart, or whatever charts you feel like cards, you can use flashcards and draw it. And the center of attraction is hope you are able to identify. This is the Eppes point where 6 nerves meet. So all the 6 nerves you can identify. And what is the other name for it? Here you can see. And punctum nervosum, that is the one. So, and what there are twos are there. How many twos? Like that. Number 2, if you remember, you can write down. And what are the conditions where it can be injured? The one is at birth, and these two pictures. Sorry. Yes. Then what are the injuries? These two pictures. If you keep these pictures also, some students I have seen, they keep some relevant pictures for that, so that that pictorial memory will be there and they correlate with a movie scene or something. There is nothing wrong in it for your remembrance. You can do it. I've seen one person doing it and it was very successful. What will be the type of injury? By looking at what is policeman's tip, and what will be why a helmet is required. That message is there in this one, and what happens, and what will be the position of the limb. So for that also, by looking at it, you should be able to give the description on how it is hanging by the side, and what is the position of arm and its rotation, and what is responsible for it, unopposed pectoralis major, and what about the position of forearm, and what is the cause of this palsy is also, that is Erbs-Duchenne palsy. And if you want to give still detailed description for the position of the muscles, then this much of table is required, which requires a lot of focus on individual muscles action, and wherever the C5, C6 route is going, that is also you have to focus. That I will focus in tomorrow's session also. I will continue with this one. Then come to a lighter side, numerology in embryology. So there are list of trees are there. You recollect what are all the trees. When a question is asked related to that, yesterday also I was showing results of fertilization. What are the barriers the sperm penetrates? And now that you have the idea of ovum and the immediately after the release, what will be the coverings of the ovum? Then you can see that one, what is corona radiata, zona pellucida, and vitelline membrane in sequence it passes through. So see this diagram, plan a diagram for that. Then you will remember this two. And what is the decidua also? Three types of decidua. What is the decidua? Basalis, capsularis, and which one will contribute for the formation of placenta? Some of the MCQs, they will be asking it. Then you should be able to explain. And what are the different types of villi also? Chorionic villi, when there is a blood vessel, what do you call it? And when there is no blood vessel, only mesoderm, what do you call it? These are the things you should practice some diagrams for that and remember them. Then the folds also, head, tail, and two lateral folds. What are the grades of placenta previa? Here you will be seeing the first, second, third, fourth. Number 4 also is there. So like that, numerology also you can use in remembering. Then, and another thing is commonly asked, what are all the events that take place during the second week of development? All are number 2s only. By looking at the pictures also, you can see. So what are the germ layers differentiated from the inner cell mass? The 2 layers, what are the cavities you will see? And yolk sac again, what are the 2? In that is the primary and secondary yolk sac, and there is a definitive also later on. Then there is the layers of trophoblast, the cyto and syncytio trophoblast, and why they are called also you should think of it. Then the extra embryonic components, what are they? Mesoderm and coelom, and how they are formed. You can look at the images also, they will help you. And what is the division of extra embryonic mesoderm? What are those 2 layers? Similarly, the intraembryonic mesoderm also divides into 2 layers, and the splanchnopluric mesoderm gives rise to the important organ, that is the heart will develop in that. And what is a cavity membranes, amniogenic membrane you are seeing here, and there is the Hauser's membrane. These are the membranes, and if you remember these two, and if you join these, you can write the second week of development, and then if they ask separately the extra embryonic mesoderm, anything you will be able to write, and the fetal membranes too, and the ends of the embryo too, by caudal plate, cephalic, and caudal axis will be decided. These are the things. And in the blastocyst also, there's a commonly asked question. And there also, if you have some proper images and then the points, you will be able to describe them. Just like 1 page, you can do it, or even half page is sufficient, and you will get full marks. So what are blastomeres? Okay, how many are there and how they are organized into the trophoblast and then the embryoblast, and how many cells in trophoblast and how they are organized and their derivatives, and how many cells in the inner cell mass and what are their derivatives. What about the polarity? So the 2 poles of it, and what are the events that blastocyst participates is the hatching. In that, there are the 2 processes, thinning of zona pellucida and implantation of it. With the timeline also, if you remember, and make it a point, you can answer for any MCQs. Then there are certain exceptions also. This way also you can prepare. So for example, all the muscles of tongue are supplied by hypoglossal nerve except palatoglossal, which is supplied by 9th cranial nerve. All the muscles of pharynx are supplied by pharyngeal plexus and pharyngeal branch of 10th except stylopharyngeus. And all muscles of soft palate like that acceptance are palati. And all intrinsic muscles of larynx by recurrent laryngeal nerve except cricothyroid. Like that, these exceptions will form an MCQ. It can be given in your routine exams also. Then in the loss of ossification, we would have taught you in the beginning, but you may not have noticed it, and make a note of them. All primary centers appear before birth. Exception is there. All secondary centers, that is epiphysis after birth, but with exceptions are there. And the center which appears first unites last with the diaphysis, and the one that appears last will come fuse first. So for this also exception is there, and all the secondary centers of ossification, different one at the end, that is epiphysis, they unite with one another and then join the diaphysis. But here also there is exception. So if you practice like this, highlighting these points, then you can recollect them, and if you keep those cards ready, you can use it. Then you can practice, see the diagram, how yesterday I should have shown it tomorrow, but I thought of showing now. So this is the rough diagram which I practice before going for the class and making a note of these things. So within that, you can find formation, course, where does it begin, where does it terminate. Yesterday someone was asking what is the sequence we have to follow. It varies with the type of question. Okay, termination and the tributaries. Tributaries in sequence you can see. So if you put in sequence, you can see the inferior petrosal sinus, pharyngeal vein. You can see I have used abbreviations only for because it's a rough part which I want to practice before going for class. Then the common facial, lingual, superior thyroid, middle thyroid veins, and this one, the occipital vein, and how the thoracic duct and this one, the right lymphatic duct, they will be joining it, and what is their clinical importance in points. If you note, if you understand very well, you can elaborate, otherwise leave it with that part. And instead of wasting time, if you can just mention them also, it will be good. Then this is the one. Okay, I have colored it later on. I thought I can put some colors. So the green one I can use for lymphatics, and appropriate coloring is also important. And for the vein, I have used this color. And if you start reading now also, you can come up, somebody is putting. Okay, so so you wanted me to repeat. Okay, I will do it. So this is another one. For a book, we may write, you do like that. Somebody wanted me to repeat exceptions. Okay, so tongue, pharynx, soft palate, larynx, all are nearby only. Okay, so these organs, there are exceptions. So if you know all the muscles of the tongue, they are by 12th cranial nerve, and if you think correlate with the development, occipital myotomes, that's what, except palatoglossus, 9th cranial nerve means from which pharyngeal arch it is coming, you correlate it with the pharyngeal arches. So nerve of first arch, second arch, third arch, so sixth arch, like that you have to remember them. And all muscles of pharynx are supplied by pharyngeal plexus and pharyngeal branch of vagus. Okay. Then except stylopharyngeus, okay, which is supplied by 9th. 9th means which arch you have to correlate. All muscles of soft palate are supplied by pharyngeal plexus except tensor palatae. So it is by mandibular division of trigeminal nerve, nerve to medial pterygoid. That's it is coming from the first arch. All intrinsic muscles of larynx, recurrent laryngeal nerve, except cricothyroid, external laryngeal nerve, which is a branch of superior laryngeal branch of 10th cranial nerve, like that. And somebody was asking about the exam pattern. Exam pattern will be one essay question and 20 MCQs, 20 marks for MCQ. Essay question is for 10 marks. And 11 questions. Yesterday also I have shown the exam pattern. 11 short questions of 5 marks each, of which there will be the clinically application and direct questions also will be there. Reasoning questions will be there. And then there is the 3 marks questions of 5 each. So there is about 15 marks and 55 marks and 10 marks and 20 marks. Now you total it, whether it is coming to 100. That is the pattern. Okay. Now we will. Now, after that, So the surface marking is another one which you neglect it. Once you go to the clinical side, you should be able to feel it. You should be able to do it, palpate it. So these are the things. So how to draw the surface marking? You can practice it on your friend. So don't think that I have to practice only on the cadaver. Some of the points which can be accessible and not objectionable, you can do it. Okay, on your own self and on your friends. Okay, this is how you can practice it. Then, so if you see in this one, what is that you are seeing? Relations of kidney. Those who has completed abdomen, they will be able to correlate it. So what is the mnemonic that has to be used for it? So if you see in this one, so you can use a mnemonic for the right. So right side. So Supreme High Court judge is daring. So what is it? And then the left one, SGS Priyanka Chopra ji, if they use, because then they can remember, because whatever is convenient and comfortable for you, remember it, but don't write it in the exam also. Okay, so write it in the rough work part or keep it in your brain and do it. And I have put another one, VAU, VAN, you know. So vein, artery, nerve in the intercostal space. What will be the structures? Because then vein, artery, ureter, anterior to posterior. These are the structures at the hilum which you will be seeing. Okay, that is the one. Then when we are studying the kidney, so how to relate to real world? Okay, that is now. What is that you are seeing? Those who are very much interested in games, IPL. So when you see
Yes,
it, IPL, and try to correlate it with what you have seen. Okay, the two cavities in the embryology. So whether it is matching, yes. And what about here? The bilaminar germ disc. This I think we can imagine it as the bilaminar germ disc. Yeah. So this also you know. Okay, what is extra embryonic mesoderm and magma reticulate spaces will appear and how they will fuse, and later on they form the extra embryonic cilium. So for this IPL stadium, look at this, whether we can correlate. See the outer ones, you are seeing so many. Okay, so we can correlate with that and try to have a picture within that one. So this is also one way of remembering. So relate to real world, that is the one, you can do it. And this is the real embryos, okay, aborted embryos. And in this you can see the amniotic sac and embryo you are seeing. And once the amniotic cavity is opened up, this is the one, around 6 weeks embryo it is, okay. That is the one. Then the major openings in the diaphragm, if you see. And so this is how you may be seeing it a picture, but you can mark with different colors for the different foramina, and you can make a table out of it. And along with these major ones, IOA, what are the other ones are also passing through that. And what will be the effect of contraction of diaphragm? You can include it, and I have already given the tip, IOA 8 and 12. So you correlate with that and make a simple one like this. And if it is given for a 3 marks question, and if you represent a diagram with this table, you are sure to get 3 out of 3. So if not, if somebody is decides not to give 3 out of 3, 2.5, they have to give it to you. Then the aortic arch arteries and derivatives. Okay, so many times it will be given as an MCQ. And if you follow this animation, okay, and this one you will understand, and I will keep quiet and you just observe it. And you should be able to remember what is it that is remaining ultimately among the 6 pharyngeal arches. So which are there ready for the, in the pavilion for the match is 3, 4, 6 only. Okay. So from that, so many arteries are developing. So remnants of the other arteries are there which are joining it. And each of those arteries you should write about the development. Why the subclavian is different both sides. These things you have to explain, because these are the one they will give question, reasoning why it is so. Okay. So hope you are able to, and then prepare the table like that. Okay. And it is there in the books also, but you should understand that table. Otherwise, you don't appreciate it unless you practice it. Okay, on your own. Then you will not be able to remember it. So this is about the pharyngeal arch arteries. And see this one. So what is that organ you should identify? And what was the section? And what is that hanging? What do you call that ligament? And within that, what you are seeing is a histology picture. What is that picture? So there is the slide of liver. And what are the various lobules which we talk about in the liver? You should be able to appreciate. And from this, you start drawing the diagram. Understand what is hepatic lobule? Yes, you are right. Falciform ligament. Good. Then there is a, and what is a hepatic lobule? What is the basis for it? What is portal triad? Okay. So and what is the center for it? What is the portal acinus? What is the portal lobule? Okay. So portal lobule is what is the shape of it and what is the center of it? Okay. So what is the role of portal triad? How they have to be, and what is portal acinus? What is its shape? Okay. And what is their functional importance? Then you should start thinking about it. That is about the liver. Then I will go on to the next one. Next. So there is a integration is also required. Don't think anatomy is separate, physiology is separate, biochemistry separate. So some topics, they have to be integrated. And one is the bile, because you will be doing the liver function tests and physiology functions of liver and extrahepatic biliary apparatus. And what is the path of bile? Starting from hepatocyte, bile canaliculi, then canals of Hering, intrahepatic bile ductus. What is portal triad? You know, now you should know. Interlobular and the other one, right and left hepatic ducts, common hepatic duct, like that. You should go on seeing it and how it will be ultimately coming to the common bile duct. This is a flow diagram and you should separate. Now you see this one. Okay, how it will be, what is the extrahepatic part and what is the intrahepatic part. So I'll check one. Because I put an animation and it is not playing. Okay, if it doesn't play also, okay. Whether you have understood or not. Okay, so there is an animation which is not playing now. So you can differentiate what is intrahepatic and extrahepatic and have a diagram. So like this, if you have the diagram, it is useful both for pancreas and extrahepatic biliary apparatus. And for the second part of duodenum, these are all the important questions. And how you divide it into intrahepatic and extrahepatic parts and what are the components. So this can form an MCQ, intrahepatic, extrahepatic biliary apparatus. So don't think it's only for passing the anatomy examination, for passing the life examinations. Then this is another method which we tried with the students. We'll give them the topic. So how to read about it. For example, extrahepatic biliary apparatus. So what are all the components? See the external features, blood supply, lymphatic drainage, nerve supply, like that, so on, so forth. So how specific learning objectives can be given to them and what are the contents under which they have to focus for each component and what is the method they can follow and total duration also. If we give, especially for abdomen, we give it for the organs so that they will focus on that and it can be a form of self-directed learning also. Because if it is a self-directed learning, you don't know how much to read. Okay, so that's why we give some broad outlines and within that outlines, they can do it, what they have to practice on cadaver and what they can observe in the organ. So that also we mentioned, practice on cadaver, okay, how to palpate for the liver, those things we will tell them. So this is one way of learning. Then
Yes, ma'am.
Emma, shall I have to stop?
Yes, ma'am, it's already we are about to
Yes.
finish, and yesterday also the assignment was not completed by the students,
Uh,
and that I have already brought to your notification. So,
yes,
the
yes,
students, as you know, that ma'am is putting up out her time as well as labor
yes, yes,
regarding collating these questions and sharing the assignment with you. So we request you to please attempt this. This will not only help you to understand where you are where you have to prepare, but these questions are something coming out from her experience and what kind of questions can be asked in your future examinations. So it would be great. I have shared the assignment link in the chat room. By this day will get over, or we can give 5 minutes extra. Please attempt the assignment. If you
yes,
still
yes.
have any doubts,
The
you can
assignment.
ask question
Yes,
today as well as tomorrow, because ma'am would
also.
be available
Yes,
tomorrow as well. But don't leave the assignment not attempted, because it will not only uh, it will be unnecessary, a waste of time for you as well as for ma'am, if you
yes,
don't understand where you are lagging behind.
yes. So this is going to be my last slide. And you know about skull prayers, how to remember each layer. And similarly for the clavipectoral fascia, try with call. And lobe muscles, the muscles supplied by median nerve. So that also an exercise for you. And this I will stop. Maybe if possible, I will show you tomorrow what, regarding remembering the development of face. So start imagining this beautiful face. Okay, till tomorrow, and we will definitely see. And okay, I'll call it a good day. And anything you want to ask, you can ask now.
Ma'am, I request you to please stay connected with us before we move, we call it a day, as
Yes,
the students have started doing it, the assignment. I
yes,
have shared the assignment, as well as in the meantime, those who have already attempted the assignment, we would like to understand your viewpoint, your feedback regarding this three-part masterclass. So we have shared a post on our social media platform where we have given out this message. I have shared it with you on your chat box. If anyone has any views, any feedback which you would like to share, please drop down a message over here in your on your Instagram accounts. It will not only help us to understand what is the need, as well as it will help us to prepare for the next classes. So I have shared the link of Instagram in the chat room. Those who have attempted the assignment, please take a minute and share your feedback over there. Also, with MEM's approval, as well as from Theme side, we would like to extend a small coupon code for all of you. The book authored by Dr. Subhadra Devi Veli Chetty. We would like to give you extra coupon code because you have taken out time, attended the series of workshop, which will continue till tomorrow. So we would like to extend a coupon code to you, and I am sharing the coupon code. This coupon code will not only help you to get the books, which are really masterpiece of anatomy, but it will also give you extra discount percentage. Please note, we are giving you 40% off on these books, on the set of the books, but this will be applicable for next 1 hour only. So hurry up, students. Take your time, and once you log on to webshop to our add the series to your cart, and you can apply the coupon code, which is Masterclass 40, and you will get flat 40% discount.
They are doing assignment, ma?
I am just checking, ma'am, how many have already completed.
Recording anyway, they will share in the YouTube. Yes, ma? They are asking
Yeah,
the
ma'am.
question.
We need to just download and do a little bit of editing
Everything
before
has
we
to be
post
done.
it.
Yes, yes, it has to be
Yeah,
done.
yeah. So we will be sharing the code on your email IDs, which you are registering over here in your assignment forms as well as in your webinar feedback form. So those who have attended yesterday as well as today, please make sure to attend tomorrow to avail the e-certificate of this particular series, as well as we will be sharing the webinar feedback form. So we have got 34 responses today till now. We have around 250 students. So please, students, hurry up. Also, in the meantime, if you want to leave the feedback on the Instagram, we would love to have your feedback in the form of comments so that it will not only help us to
Yes.
have more series of extra subject, but I will also request ma'am to have it one more series of anatomy in near future.
If the students want it, definitely I am for students. There is no doubt about it.
That's
Okay.
very true, ma'am. And I have seen that with lot of patience as well as taking out your time from such a busy schedule, it will majorly help the students to achieve good marks as well as to clear their doubts from
Yes.
the anatomy, from the subject, whatever the doubts, maybe a
Yes.
little bit of doubt, but there are times when they hesitate to ask.
Yes, that's why I try
This
to go extra
form
mile, more sessions in near future. Sure, if you are able to, if it is useful for you, definitely.
useful for them, ma'am. This is only theme is only thinking about student at this point of time when they're approaching with their examinations soon. So
What
we are
points? Someone is asking what points to come in. We aren't getting. So that's we aren't getting. So what points? Because when you are writing, what about depending on the subcomponent relations means what point you have to write, whether they are the anterior, posterior, medial, lateral relations only, and whether there is any clinical application of it. That also you have to link it. So link this one to ultimately how it is going to be useful. I have shown you in the extraocular muscles of eyeball. Each point is there, and what is the diplopia? For that also I have categorized it, and it is in one format. You have to think of it. Don't think of writing sentences. I am telling you again and again. Understand and note a point. Okay, that is the best way to understand it. Don't think that this book, all 450 pages, I have to read and be thorough. Okay, so what is the gist of it? You should know. If you see a movie, you will have a gist. Some message from that movie is there. Some good message, bad message, and then the coloring part. All those things. What is it that catches? That will be the thing you take from a movie, and this also think that you are the one who is producing that 5 marks movie or 3 marks movie or 1 mark movie. So how to make it successful? That should be your aim. Clinical cases, yes. What organ it is pointing to, and what condition it is pointing to, and what is the anatomical basis. You have to see. That's how you have to proceed for that. Something he's
Is the
asking.
test prep series containing question papers or is it like short notes? It is
It's
like,
having,
yeah, yes, ma'am, you can go ahead.
it is having the question, not questions itself is there. It is competency wise questions are there, and then for that answer is there in that. Okay, all subcomponents are there, and there are MCQs also. I think they are online, and
Yeah.
mnemonics are there. Nearly 70, 80, or nearing 100 mnemonics will be there.
Yes, yes. It's a
Initial
question
pages.
answer formed book. It will not only help you to understand what kind of questions can be asked in your question papers in your upcoming examination, but it will also help you to tell how to answer those particular questions.
Yes.
So the concept has been designed in such a way that the concept is being cleared as well as what kind of questions can be asked and how to answer them. So the series will surely help you out. It is as per ma'am's vision for this particular book. That's how we have published it. So it will help you, as well as there are several other online resources along with this book which you can avail it once you have the printed copy. Is question paper pattern changed for Telangana state also, ma'am? There's a
I think it will
question.
be, all states, they have to follow uniform pattern as per the NMC.
I hope your question has been answered.
And you will get the model question paper also, because I was in one of the BOS member, and that university, they are following whatever NMC says. Okay, so majority they will
Can we
follow
get
that.
good marks if we prepare only important topics, ma'am? It's a question in the chat room.
So what is not important? That will not be
That's
there.
also
Okay,
true.
there are some straight away ones, definitely no, must know. Okay, those questions you have to go. And some is good to know, and some is, yes, we appreciate if you know a bit of it. Okay, something about everything that should be there, and more about some of them, and very deep about some of them. Like that, you come from the other side. And for histologist rights also, yesterday I have shown how to differentiate all lymphoid tissues, read it once, all glands, read it once. Then you will know how to differentiate one from the other. That will be easy for you. That's the one way.
Students, I haven't received your feedback on Instagram post where we are showcasing a 3-day program by Dr. Veli Chetty. It will only help us to understand whether these programs, these kind of master classes are really required in near future. So I'm again leaving the Insta URL in the chat room. Please share your feedback in the form of comments. I know you people are liking it by sharing a like, but please leave a comment over there. Purushottam, thank you so much. Leave a comment on the Instagram. In the meantime, thank you so much, ma'am, again for your session today.
E-book is not available. He was asking about e-book, one person.
E-book is available once you are purchasing the printed copies. So printed copies has the e-version, e-resources available for that particular book, which are more or extra from your textbook or the book. So it will have more content available online resources where ma'am has already told you about 100 plus mnemonics over there, as well as several other resources are available, the MCQs part.
MCQs and clinical cases are also there.
Clinical cases, yeah. I am really sorry, whosoever is asking between Vishram Singh or BDC over here in this particular
zero. Sorry.
We are not promoting or we are not saying any series. Every book is very important, but ma'am is here to share her teaching methods as well as her knowledge with you.
And even if you start from today itself, someone was asking, he is at 0 level. Yes, definitely you will come up to 40 to 50%, which is the one required for passing. Okay, so but practicals you have to get 60%. If you are getting 40, here 60. So why do you want to have the mercy of somebody? You can get 50% provided you read it methodically and don't go on reading a vast subject I want to learn within this 2 months or 1.5 month short period. So learn the basic things what are required and practice them repeatedly. That's the only way. Okay, definitely be confident and have confidence in you, faith in you. That will help you. Okay, that person, don't think you are at zero level. No one will be at zero level. You will be at 20% level, I know. Okay, so from 20% you can make 50% is very easy, I assure you. Okay.
Last query which I'm taking, ma'am, how to make diagrams simplified? Can we draw easy diagrams from Chrome rather than the textbook?
Oh, yes, you can draw some of them easy diagram only. I have done, yesterday, the coverings of spermatic cord. Okay, that was easy. What is the problem drawing circles? And some of the diagrams, I don't know whether I have drawn, I have kept, and maybe it will come tomorrow at least. I will show you those diagrams. And
Yeah.
whatever flow chart I have noted, my handwriting, sometimes it will be good, sometimes it will not be. But still you can understand and make it. Okay. Yes. Don't think for everyone you have to draw the diagram. If there is a possibility, a simple one is there, do it, draw it. Okay.
Last
Thank you
question
for
from G.
this
Janvi. It is like, ma'am, will
session.
having the
Okay,
gist of
Purushottam.
everything
Okay, what about the others? I'm seeing Purushottam
even
there.
yeah, only Purushottam has written on our
Or else I
platform.
will show some pictures, then they will be.
Yeah. There is one more question which I would like to take, ma'am. Ma'am, will having the gist of everything will be enough for exams like NEET PG? I believe in first year NEET PG would be a long vision to look forward to, but we will surely take your question. Hello, ma'am. Subhadra, ma'am.
I think completed.
The question is the question what the student is asking
Completed?
is that, ma'am. No, ma'am. The last query which I'm taking. Hello.
Tell
Hello.
me.
The last question is, ma'am, while reading the text, I'm unable to decide which points to keep in mind and which one to ignore. And memorizing everything is definitely headache. But considering exams like NEET PG, I'm confused what to do, ma'am. What do you suggest?
That's why, what is the crucial points? You see it. See the book. Then you will understand what are the points you have to focus. Don't go for a bigger one. So don't think that I'm telling, read this timer book. Okay, so the timer book is for points only, those who are feeling difficulty in elaborating it. First, you get what is the important one, and if you want to elaborate on that, go for another book and elaborate it. The basic things. So what I should know. For MCQs reasoning, so many books are there, ma. So you can prepare your own. So many cases. Most of the case scenarios, sometimes I will make it a imaginary paper-based case scenario, or seeing at one instance, I will make a case scenario. Okay, so many. And if you have the basic rules in your hand, you can identify it. Histology slides also, there is an easy way to identify, but this half an hour session will not be available. I will do it separately. We will see it because
Maybe tomorrow we can take it up.
Yes, some of
Also,
them.
is there any book for MCQs? MCQs you can look forward for Dr. Veli Chetty's book only. Theme Test Prep Series Anatomy. I have shared the link in the chat room. As well as we are running 40% discount on that particular series for next 1 hour. Rest, the students whose questions are not answered this time, we will surely take up your queries tomorrow. Please make sure that you log in tomorrow by 6 p.m. The codes will be shared on your email IDs which you have given to us. as well as in your student groups with the help of your class representatives. So thank you all for today. Thank you so much, ma'am, for giving out time again.
Thank you. I'm happy
And,
today some people asked some questions. I'm happy because yesterday it was a hurry. Now today I'm also happy. Yesterday I felt bad. I did not do properly.
No, ma'am, no worries. Thank you so much for your time again. And we look forward to meet you tomorrow. All of you guys, looking forward to meet you tomorrow. Thank you, and please do drop your assignments. I will share the details with ma'am once it's completed.
For
Thank you
long
so much.
long question, even if it is one page, it's okay. Whether the stuff is there, okay. Don't think that you have to write 10 pages for long question. Huh? Okay, and the long question is only 10 marks. So now I was telling you, which is high value questions. Okay, high value questions are your 5 marks questions, 55 marks. Okay, 11 questions. So focus on that. Okay, so combined these 5s only, it will become the 10 marks question. Okay. Yes, sentence formation not necessary, points are necessary. Try to split that sentence part. Okay, and what you have understood.